That's great. Thank you.
Thank you for attending today's hearing. My name is Letitia James, but everyone refers to me as Tish. Refer to me as Tish. And believe it or not, I'm the Attorney General of the state of New York. Yeah. So my office is examining the decision-making process of Samaritan and St. Peter's Health Partners regarding the closure of Burdett. We want to ensure that their actions align with their commitments to the community and their charitable missions. And as you know, St. Peter's Health Partners, which is a part of the Trinity Healthcare System, has announced plans to shut down the Burdett Birth Center. This decision will affect the only labor and delivery facility in Rensselaer County. And what we've heard to date from the community, the patients and staff raises significant concerns. And I want to recognize all of my colleagues in local, county, and state public service who are here today. Let me just say, and my colleagues in public service at all levels have been real partners and leaders in raising the alarm bells about this situation. As most of you know, I'm no stranger to Rensselaer County. I worked in the state legislature for 10 years, and I'm very familiar with this county. I want to thank everyone who submitted testimony for today's hearing, and I want to thank St. Peter's Health Partners and Trinity Healthcare for submitting written testimony, which we will review as part of this process. Today's hearing will help guide our next steps to ensure this community receives the essential care it deserves. The Burdett Health Center at Samaritan has been the only birth center in Rensselaer County since 2011. And last year, 881 babies were born at Samaritan Hospital. If you had a baby at Samaritan Hospital, can you raise your hand? Okay, I'm glad the cameras picked that up. And from January to May this year, 320 babies have been born. Unfortunately, St. Peter's Health Partners, which is the hospital's corporate parent, has proposed a plan to shut down the birth center, citing financial struggles caused by the pandemic. The proposed plan is currently being reviewed by the New York State Department of Health. They will not be testifying today, but I understand that they are here somewhere in this audience. If approved, the Burdett Health Center could be closed by the end of the year. And frankly, I am worried about the possibility of the center closing. Being the only maternal unit in Rensselaer County, it offers essential healthcare services to a community that has long been underserved. And crucially important is that its staff is culturally aware and sensitive to the needs of its diverse patients. And I really want to thank them for all that they do. We've heard from a number of residents who were cared for at Burdett and reported feeling seen and heard and respected. And that's a rare and vital experience, and one made possible because of the team at Burdett, and I want to thank them. And so it seems to me that it's really better to replicate a facility instead of closing it down. Now, we've all seen responses that advise Burdett's patients to deliver at another area hospital, but suggesting to someone who had intended to give birth at Burdett simply to go to give birth at another hospital is not a practical solution. The advice overlooks the difficult circumstances that many of these residents face. It is a broad, dismissive response, and these expectant patients are not being told to drive to a different facility across the street or down the road. They're being told to go to another county, to potentially drive an hour further from here. Now, I've heard that there are medical deserts all over the state of New York, and particularly in rural counties, and that it's particularly difficult to hire medical professions. But that ignores the challenges faced by residents, and that ignores the promises that have been made, as well as the potential impact on other regional hospitals. Finally, we must address the fact that the closure will break a promise made to the community at the time of the original merger. And if you will, let me just say that at the time of the merger in 2020, approval of the application is intended to preserve maternity services in Rensselaer County. especially for the significant low-income population, even though other reproductive services prohibited by the ERDs have been discontinued. Again, that came from their application back in 2020. When the hospitals merged and Burdett was built, St. Peter's Health Partners and Trinity made several promises. Promises to their community, to their donors, and to my office. Promises about the level of care that would be provided. A closure would not only undermine those promises, but may very well erode trust in the hospital system altogether. And all of these factors must be taken into consideration today as this process moves forward. Just as this hearing is offering the public the opportunity to express their views on this issue, the Office of the Attorney General has provided the opportunity for Samaritan and St. Peter's to present the basis for their decisions so that we can give due consideration to the financial issues reported as the basis for the closing. I thank you all for coming today and for your interest in this issue that is central to this hearing, and I want to give special thanks to the Save Burdett Birth Center Coalition. To this issue. All of Rensselaer County owes advocates involved with this coalition a debt of gratitude. And before we begin, I'm going to allow the members of the dais to introduce themselves. To my far left.
I'm Jim Sheen. I'm the Chief of Charity of the Bureau of Attorney General Chambers Office.
Megan Fox, I'm Chief Deputy Attorney General for Special Justice.
Good afternoon, everybody. Darcy Srinivasan, Chief of the Healthcare Bureau.
Good afternoon, Jennifer Allenson from the Office Office.
Thank you, and with that, let's start things off.
Thank you, A.G. James. Good morning and welcome. I am Jennifer Allenson, and I will be
Thank you. And I will be today's parliamentarian. In this role, I am responsible for the timing and flow of today's proceedings. Here's a brief overview for the speakers. Each individual making a statement or testifying will have an allotted amount of time to speak. There's a countdown clock visible to both the panel and the individual speaker such that they can monitor their time. I will give a 30-second warning by showing a sheet of pink paper so that the speaker can begin to conclude their testimony. And after each speaker is done, there will be time for questions and answers, if any, both individually and in small groups. I'd like to just take a moment to point out there are restrooms through the doors in the corner over there. There are restrooms on this floor and 2 upstairs. Now I would like to introduce our first speaker, Assemblyman John McDonald. Please confirm that you were sworn in.
I was.
Thank you.
So Tish and team, thank you. Thank you for what many people observe to be an unprecedented here on this topic. And I thank you because in my 23 years of public service, I've seen a lot of things. I've never seen one issue unify the community against an item such as this. I'm not going to read my notes particularly. I want to just share the concepts with you. The fact that you're having this hearing when St. Peter's hasn't had one speaks volumes. Their consultant charts did a survey that was fraught with difficulties, that the public had great challenges with, and was stopped after about a week. That is a disservice, and I'm glad you're here. I want to focus on 2 main issues. One is finding a partner for future birth services in Rensselaer County, if this closure cannot be avoided. But also, to your point earlier, finding a partner that women can trust. I've been in healthcare for 33 years. I never would have thought that we'd be debating the decision to terminate maternity services in our region with St. Peter's Health Partners, a Catholic institution. This is not just a Rensselaer County issue. It's an Albany County issue, a Washington, Columbia, Greene County issue as well. It's an issue that impacts rural areas, impacts urban areas, impacts the Black and brown community, and as we all know, a community that is experiencing high-risk outcomes, high risk in healthcare, and just as importantly, above average maternal mortality rates. Burdett Birth Center itself is well known for its midwife services that it provides here in the capital region, not just Detroit, but for the capital region. Over 50% of the deliveries or catches, as they're known, are through the midwife services. What's bothersome to me, as a legislature, in the last couple of years, has passed legislation to establish midwife-led birth centers. And the Department of Health is currently has regulations out for comment. St. Peter's has chosen to run in the opposite direction, figuratively and literally. It is going against the will of the public. It's going against the will of what is a preferred service, a service that in most cases is safe and secure. Arguably, not every delivery can be through midwifery services, but we need to trust the system, and we need to have a trusted partner. I contend that the healthy birth of a child and the health of a mother are not meant to generate profits. And if an entity must have a lost leader, I cannot think of a better purpose for a Catholic institution than the birth of a child. What is extremely bothersome to me is the lack of consultation prior to the announcement with the midwives at BBC. I find that to be insulting and a major large sign of what their intentions are in regards to midwife services in the future. Similarly, and I meet with St. Peter's quite regularly, during the budget process, we heard from all hospitals, including this system, we need a Medicaid increase. Our rates are terrible. We need more resources. And the legislature, Republican and Democrat, responded with a 7% increase in Medicaid rates across the board, which is 50% of the business that St. Peter's claims it to be. And at the same token, thanks to our federal partners, a 37-point swing in reimbursement on Medicare rates across all lines of business also was increased. These are not my words, and the words of the director, the president, and CEO. Those changes alone, just with Medicare, will lead to a $100 million increase in revenue to the overall system and allow us to make our margins. Make our margins. This is not a grocery store. The mission of St. Peter's is to serve together in the spirit of the gospel as a compassionate and transforming healing presence within our communities. Their actions being proposed is a stark contradiction to what the mission statement states. In closing, as New York State AG, your role in oversight of nonprofits and hospitals is critical to the well-being of all the residents of the state of New York. Inasmuch as St. Peter's has valid complaints regarding reimbursement, we've taken the corrective action to provide them financial sustainability. But let's not forget, they are supported with public funds, not only related to operations, but also in regards to large capital grants. Additionally, these organizations are afforded tax-exempt status because of their mission to provide care. However, when entities stray away from their mission, it is critical and appreciative that your office is closely scrutinizing and verifying that the public benefit is being served. My hope is that St. Peter's, in light of the significant increase in revenue, will rethink their decision and show the community that partner is not just part of their name, but a promise to the community to be fulfilled. I, along with many, remain committed to finding a long-term partner to retain birth services in this community. And once again, thank you, not only for bringing this year together, but your in-person attention to this detail. Thank you.
Assemblymember, can you speak to the legislation that was passed, HEIA, and whether or not SPHB failed in fulfilling the intent of that law?
They are intending to fulfill the intent of the law. New York State is an outlier when it comes to midwife-led birth centers. 40 other states have it. It's well established. It's well accepted. Particularly in the Black and brown community, we have a lot of health issues, a lot of unnecessary surgeries that do cost more and bring greater reimbursement. But at the end of the day, as a person who's providing health care, as a pharmacist, it's not about how much it costs, it's about what's best for the patient. And as these regulations are now under review from the Department of Health, I found it shocking and appalling. Number one, that St. Peter's would actually introduce this 2 days before the deadline for the equity assessment. But just as importantly, as these regulations, as you've noticed, are under review, as New York State is moving in one direction, St. Peter's wants to move in the other.
And St. Peter's voluntarily decided that they were going to voluntarily comply with the equity?
So, and I've had this direct conversation with the CEO. Yeah, they voluntarily complied, but let's be clear. They amended their certificate of need without any attention to any elected official 2 days before this new regulation went into place. I don't find that to be very charitable, to be honest with you.
And they give you any advance notice that they were closing down the Burdett Birth Center?
I received an email the Friday before to please contact someone, and the staff member was alerted over the weekend what was happening, and that was it. Many other elected officials may be testifying today, and many of them were indignant because they were not contacted.
And can you talk a little bit about their broken promises from the time of their merger in 2020?
This has been part of the challenge, and this is what I hear most from, like I said, all realms of society. There are many long, loyal supporters of this organization that have given their time, their talent, and their personal treasure for this organization to survive. Every time there's a request for funding, they step up. The fact that a promise was made, this service would be retained, and now we're here, out of the blue. I want to add something. In all those conversations in the budget process, I give Albany Met a lot of credit. Dennis McKenna told me, if we don't get this funding, we're going to cut this, we're going to cut this, we're going to cut that. Never once did St. Peter's bring this up, because they didn't have the courage to. Because if they knew, they would have had a lot of trouble on their hands right off the bat. So the bottom line is, they've handled this poorly. As we're seeing an upswing in reimbursement, I think sustainability is more possible than ever before. I find it very difficult when I have to hear that we need to make our margins. This is not a grocery store operation that needs to make 3%. And their goal is to make 3% on everything. It questions to me what the difference between a for-profit and a non-profit is with public funds.
Thank you, Assembly Member, for your leadership.
Please, everyone, silence your cell phones. Good afternoon. Our next panel consists of Zanetta Gary, Deirdre Shea, and Tia Green. Will you all please confirm that you were sworn in prior to now?
Yes. Yes, I am.
Zanetta, you may start.
Good afternoon, everyone. So if you have been...
Just speak into the microphone.
Oh, can folks hear me?
Okay.
Thank you. So good afternoon, everyone. You may recognize my name, my face. This is not the first time that I've had the phenomenal opportunity to address the public regarding this travesty that may happen. So some of this may sound familiar to you, but just to start, what's really near and dear to me that I will continue to emphasize while having this conversation is that the closure of Burdett Birth Center is not only going to create issues in the community, it's going to exacerbate existing issues, right? Anyone who has any exposure to public health, any exposure to just the data and the realities of the maternal birth rates or maternal health conditions in New York State know that Black women are in danger, and this closure is only going to further that. I am here today as a Black mother, a Burdett mother. I had my daughter there, Madison, about 5 years ago. However, even though that was a few years ago, I think the conditions still remain the same, even back then. That decision to have my daughter at Burdett was because I had the privilege of being aware of the conditions, being aware of the dangers I was potentially in with being a pregnant Black woman, with being a birthing Black woman. And so I did my research as best as I could. And Burdett, again, far and wide, just stood out as far as a place for me to give birth where I felt like I would be safe, I would be seen and heard and be honored. And that's what's most important. I want folks to remember during this process is that it's not just about the access, right? It's about the quality of the access. Yes, there is another center that's not anywhere nearby, but it's easy for folks to say, oh, well, they can just go to Albany, they can just go somewhere else. But the experience is not going to be comparable. And when it comes to being a Black woman, that will make or break our experience. We know that the rates of low birth weights for our children, us returning to get proper prenatal care, the rates are really, really low. And it has been documented that part of that is because of our experience. When we go to the doctor's office and we're being treated as second-class citizens, we're not having our requests honored, we're not being seen, we're being treated as if our opinions don't matter, we just don't go back, right? Until it's time to have that baby, and then people pop up in the delivery room after not receiving proper prenatal care. So I really want to emphasize that, again, it's just not about the structure and accessibility to a center, but it's about the people who work there too. Those people who show so much care and compassion. In my personal experience, that made my birthday experience amazing, and I just couldn't imagine where else I would go if Burdett was closed. I can't imagine where the other Black and brown women would go as well, because I've heard stories, horror stories about birth experiences, and I feel very fortunate about my experience, and I really give all that credit to Burdett. I really do. My entire time at my stay there, my birth, my delivery, every part of it, I was welcomed, I was loved, I was cared for, and that really made a really huge difference. And so we'll be doing a huge disservice to the community. There will be countless implications for this closure. But most importantly, I just think about the treatment and the experience of people who would not be able to experience that quality of care that only Burdett can provide. No one else is taking care of us the way they do. And I hope they can continue to care for the community.
Hi, I'm Deirdre Shea. Excuse me, I'm just going to read from my notes. A little over 19 months ago, I got very sick with a stomach virus. I was very pregnant, and my first child was due imminently. I was unable to keep down any liquids or solids for over 24 hours. I had planned to give birth at home. My midwife, who is licensed for home birth but does not have hospital privileges, became worried about my hydration levels. I was also showing signs of early labor. She sent me to Burdett Birth Center, which is 7 minutes up the hill from my home in South Troy, to receive IV fluids and check the baby's vitals so that I could have the strength and opportunity to give birth at home like I had planned. I was hesitant. I was a little bit afraid to go because I was afraid they were going to make me stay at the hospital and give birth there when I hadn't prepared for that. My midwife assured me that going to Burdett would be safe.
She had sent patients to Burdett many times over the years, had relationships with the nurses, midwives, and doctors there, and she called ahead to explain the situation. Because Burdett is birth-centered, they were able to comprehend the situation, trusted my midwife, and I was cared for with a lot of respect for my birth plan. And after giving me fluids and checking on the baby, they let me go home to give birth. It felt like a community care situation. I don't believe I would have had the same support in a different facility. If Burdett didn't exist, I would have had to go to the ER, where the chances are high I would have been pressured to stay to give birth. After I received IV fluids and went home, I also experienced a minor complication where my baby wasn't coming out totally straight. I pushed for over 6.5 hours. That's 3.5 hours longer than the average first-time vaginal birth. My midwife, who was over 20 years experienced, knew that my baby and I weren't at risk, and she was able to guide me to a successful and healthy birth. Again, if I had been in an ER, it is not lost on me that I would have been pressured to take synthetic hormones to speed things along, or into a C-section when it wasn't necessary. I'm not being dramatic. We know statistically and anecdotally that this is what happens in hospitals that do not provide holistic and birthing parent-centered care, particularly for poor women, for BIPOC women, especially for Black women, all of whom are already underserved by the healthcare system in our region, which is uniquely urban and rural at the same time. The people that Burdett Birth Center serve in our community deserve holistic and birthing parent-centered care. My personal birth experience was incredibly privileged. Despite the complications, I was able to give birth the way I wanted to, in a way that felt most healthy and safe for me and my child. And if I had to stay at Burdett to give birth, I feel that it would have been a safe place to do so. Or at the very least, has providers that are specialized in birth and birthing complications, which an emergency room does not. Keeping Burdett Birth Center open is the bare minimum in providing safety for the women and the people giving birth in our community. Everyone should have the option, and it should be their right to have nuanced maternal care in the way that is right for them. And the U.S. has the highest maternal rate when compared to countries of similar wealth. We have the technology and resources available to save lives, yet many hospital systems treat the birth experience as a time suck and a liability instead of considering the needs and the health of people giving birth. Burdett is special. If Burdett is closed, it will force more women and birthing parents to go to the ER with doctors and nurses that aren't specialized in birth and women's health, because that will be the only option for many in our community. Again, it was said before, there are other facilities far away, but it's not that simple. Please don't take away this holistic resource from our community.
Hello, everyone. My name is Tia Green. My first experience with our midwives happened back when we were seeking health over at St. Mary's Hospital. So I have a very long history with them. I was only 16 years old. They provided me with education through the Teenage Opportunity Program, where it was a place where we met once a week to discuss infant care, how to be a parent, patience, any and everything under the sun. So they really prepared us as young parents who needed a little bit more, education and patience to be, my mom was stressed out. She thought I was pregnant. And that program meant something to me. It meant something so much so that I was under the care of the midwives for another 7 years before I had my second child. I went back just because of that, and at 22 years old, I begged them to sneak me in the Teenage Opportunity Program. And it was the funniest thing that my midwives just absolutely encouraged the fact that I wanted to be comfortable again and relearn what it is that I learned there, because it was so special at the time. My first child that I had over at the Burdett Care Center, again, I've been following the midwives the entire time, even after the merge with St. Peter's Health Partners, and we were kind of private for a little while. And again, 2014 was my first experience, and when I tell you they want you, you have to push the baby up. They can't come and snatch it. You have to give birth. They want you to give birth in the, most intimate way, or, the things, and I said it's the quality of care. It absolutely is. It means something to make you want to come back and be comfortable. And it's very, very empowering. I am now on my 6th kid, and if I had to have this baby anywhere else, I guess it's going to be at home. I don't want the birth center to close. I really feel like they bring a unique form of care for every individual woman of any and every race and color. And that's the empowering part for me with bringing life into this world. That makes it special. The demographics alone is stomach-wrenching for me that we would have to rely on any place else when we had a lot of people outside of our demographic prefacing the Burdett Care Center and to come there, passing by their own hospitals. Think about it. The data sheets that we bring up at the RAI Chapel last August were baffling, and it made sense that this is something you don't want to change if they have excellent rates and happy results from not just one group of women, all of the women that actually go here. I think it would be devastating to our community and disheartening, to say the least.
I want to thank the three of you for your testimony, because what you have confirmed is that women, low-income women, people of color, particularly African Americans, too often receive culturally insensitive care that can be dangerous to their health. And I truly want to thank each and every one of you for your testimony. We all know that for African Americans, according to the CDC, are 2 to 3 times more likely to die from pregnancy, from preventable pregnancy-related complications than their white counterparts. And all of you have indicated as such. And so if Burdett closes, where would you go? Where would you go for maternity care services? And how would you get there?
Midwife, Pam. I'm going to have my baby at her house. My midwife, Pam, I picked her. She was the best out of all the 5 babies that I've already had with the midwives.
Okay. Anyone else?
Yeah, I would have my baby at home. I've been fortunate enough working in the maternal care field. I know some amazing midwives, like trailblazers in this topic and in this field. And so I will just gather everybody up, Letitia, Rose, everybody, and come help me deliver my baby at home.
Thank you. Along those lines, did either or any of you receive prenatal or postnatal services at Burdett, and how would the closure affect your ability to receive those services going forward?
I got prenatal care at Burdett as well because my midwife, since she's a home birth midwife, didn't do any imaging, so I got all my imaging done at Burdett. There was one time where they didn't have an appointment available. I had to drive to Newschannel, which is